England warned it faces 6 million new cancer cases by 2040, with these areas worst hit. A coalition of more than 60 cancer charities is warning the government must take urgent steps to tackle cancer care in England. More than 6 million new cancer cases could be diagnosed in England between now and 2040, according to leading charities. This would equate to a diagnosis every 2 minutes, which is up from one every 4 minutes in the 1970s. A coalition of more than 60 cancer charities, known as One Cancer Voice, is warning the government must take urgent steps to tackle cancer care in England, including faster diagnosis targets and better prevention policies. The analysis carried out by the charities is based largely on pre-pandemic data and suggests cases will increase by 14.2% over the next 15 years, with diagnoses of some of the most common cancers reaching all-time highs. This includes over 1 million new prostate cancer diagnoses, and more than 900,000 for breast cancer by 2040. The research also finds regional variations. Southeast, over 1 million diagnoses. Northeast, 865,000. East of England and the Southwest, 722,000. London, 714,000. These figures starkly set out the need for change, and the timing of their release is significant. Later this autumn, the government is expected to publish its long-awaited National Cancer Plan. These leading charities have combined forces to put pressure on ministers ahead of its publication, demanding 6 measures which they say must be implemented if cancer outcomes are to improve. A pledge to meet all cancer waiting times by the end of Parliament in 2029. A new earlier diagnosis target, with improved screening programs. The introduction of strong cancer prevention policies. Addressing inequalities in patient care. Improving access to clinical trials for cancer patients. Better support for people to live well with and beyond cancer. The pandemic had a huge impact on cancer care in the country, and an aging population adds further pressures. But the most recently available data, which is around a decade old, suggests the NHS is still lagging behind many comparable countries. The chief executive of Cancer Research UK, Michelle Mitchell, described the national plan as a defining moment. If the UK government delivers an ambitious fully funded strategy, we could save more lives and transform cancer outcomes, propelling England from world lagging to among world leading when it comes to tackling this disease, she said. A Department of Health and Social Care spokesperson said, "This government is prioritizing cancer care as we turn around more than a decade of neglect of our NHS. We're already making an impact, with 95,000 more people having cancer diagnosed or ruled out within 28 days between July 2024 and May 2025, compared to the same period the previous year."